Welcome to Let's Talk Lungs with Bethany from Lungs, Saskatchewan, dedicated to connecting you with lung health experts, key opinion leaders, and people with lived experience who share lung health information and personal lung journeys to inspire you and those you care for to take your best breath. This podcast is recorded on Treaty 6 territory, the ancestral and traditional territory of the Cree, Dene, Blackfoot, Saulteaux, Nakota Sioux, and the homeland of the Métis.
Hello, everyone. Today on the podcast, I'm joined by truly one of the experts in smoking cessation and lung health and a good friend of Lungs Saskatchewan, and that's Dr. Erika Penz. Thank you so much for being here.
My pleasure.
Dr. Penz is an associate professor and division head of respirology and sleep medicine at the University of Saskatchewan. She is physician co-lead for the COPD Provincial Clinical Network. Her main research focus includes burden of disease studies with a focus on lung health, including tobacco cessation, effects of vaping, and management of severe asthma and COPD. Dr. Penz, we are so grateful to have you here today. We're going to be discussing quitting smoking and some of the things that people can consider when it comes to taking care of your lung health on your quit journey. This episode of Let's Talk Lungs is sponsored by Nicorette, a longtime supporter of lung health in our province. Nicorette has stood alongside Lungs Saskatchewan for 5 years as a proud partner of the annual Saskatchewan Quit Smoking Challenge, helping thousands of people take those important steps towards becoming smoke-free. Dr. Penz, thank you for joining me today. Can you start by telling us a little bit more about yourself and your areas of research and clinical practice, and specifically your interest in smoking cessation?
You bet. My pleasure. So as you said, Bethany, I'm an adult respirologist based here in Saskatoon. I practice out of St. Paul's Hospital and Royal University Hospital. I'm also a clinician researcher at the university. And my focus is largely clinical related studies, particularly in overall lung diseases. But, I've spent some time evaluating people living with COPD and the impact of that particular condition, lung cancer screening and the benefits that may provide to people at risk for lung cancer, and really also focusing around the benefits of smoking cessation, including, in the last couple decades, a hotter topic around vaping and the potential impacts that also has on our lungs. So, yeah, I dabble in a whole range of research areas. Mm-hmm. But to your question around what got me into, smoking cessation and that interest, well, it really started when I was finishing my fellowship. I was at the University of Calgary, and at that time I actually did a small course at the University of Calgary on decision modeling and health economics. So my research training is as a health economist and in health policy, and so I did this decision analysis course that asked us to do a project. And for context, around that time it was 2011, I think, and we knew from lots of good evidence that using medicines like, for example, varenicline or bupropion, and we can talk about those more a little bit later in the session, as well as nicotine replacement therapy, all of these pharmacotherapy aids we know that they're very effective in helping people to quit. And we actually know that they are cost effective. So that, and what I mean by that is they're good value for the money we spend, right? To do that. But what I was, in Canada at that time and in the provinces, I think there was one province that covered particularly the oral medications, varenicline and bupropion. And so I thought, well, why is that? Why, when we have effective therapies, do we not have coverage? And, I wondered about what's the impact of people paying out of pocket for that. And actually, in fact, there were some studies that showed that when you take away the cost of these medicines, people are more likely to quit and they're more likely to have success. And so anyways, I developed a model that sort of projected the potential cost savings to a provincial healthcare system and the benefits to patients in terms of, their quality of life and saving lives long term. And that got a little bit of attention from media, as well as got published as an editorial in our Canadian Medical Association journal. And eventually we did publish the publication. But that kind of project really launched a lot of, my interest in advocacy and trying to really push for, coverage for individuals, knowing that that's just one part of the puzzle in helping people and our society as a whole to reduce commercial tobacco use. But that's where it started.
Amazing. Well, and we know that you're a huge advocate for the work that we do at LungSask in terms of trying to reduce barriers to quitting smoking and, protecting youth against the harms of vaping. So we appreciate all of the work that you do. And I think it's important to do what we can to make sure that people can quit smoking easier, right? Yeah. So we know that a lot of the folks who smoke also deal with health challenges like COPD, which is something that you spend a lot of your time working in. And a big motivator to quit is the improvement that they might see in their health. So can you tell us a little bit more about what changes happen in your body once you quit or cut back smoking, specifically if someone is dealing with a lung disease?
You bet. So people, I think, can expect, we know there's some very immediate things that can happen in our body when we stop smoking. So even within 20 minutes, 30 minutes, your overall heart rate and blood pressure can return back to their baseline. So they generally tend to rise when we smoke cigarettes. After about 8 hours, we know that the nicotine levels in our body also reduce significantly, almost to zero, and our oxygen levels, or our ability to properly oxygenate our hemoglobin, improves also as we spend less time having access to smoking. And really by 24 hours and 48 hours, like carbon monoxide in our body is gone. Our airway muscles, they start to relax, and really people can notice, very quickly, even some easier time breathing. I think in the, weeks to months after, I think people will still notice some improvement. So some people may notice within months, some improvement in their general lung function. A lot of my patients talk to me about what happens to their cough. So they, and they say, I coughed less when I was smoking. And,
right.
And there's a reason for that. So when you quit smoking, so what happens when we smoke, what happens to our airways? All of our airways have these things called cilia. And the cilia, you can think, is kind of little finger-like projections that help us clear mucus and stuff out of our airways. And they become paralyzed or, really quite frozen when we are smoking, because of all of the chemicals that the airways are exposed to. So when you stop smoking, those cilia actually become more mobile, and they can more effectively move your mucus out. And so people will notice increase in their cough.
It seems counterintuitive.
It does. Yeah. But, our lungs and our airways are meant to cough and clear secretions. So it's a good thing. So don't, it can be, of course, a bit of a sometimes an annoyance for some people, but it is part of the body's way of clearing, what's been sitting there. So, yes, I just really try to tell people, expect some changes, right, to your cough, which it's just part of your body's way of dealing with it, and eventually that actually does settle. So. Over time, people will describe less respiratory-related symptoms when they're not smoking. Yeah, so I think that those would be kind of the more immediate and short-term effects that people might notice. The longer-term reality is, though, that, we reduce our risk, of really, significant health issues. So we reduce our risk of cardiovascular disease. We reduce the risk of, progression of our underlying lung disease. We know that smoking can accelerate the decline in our lung function over time. So when you quit, you see stabilization of that, and some people actually can improve. And we reduce our risk of cancers, and we can actually live longer. So if you were to quit smoking, when you're sort of in that early 40s, you basically can return your life expectancy back to normal within 10 years, right? So there's some real tangible benefits.
Yeah, absolutely. And so if somebody, for example, has COPD and they're like, well, why would I even quit at this point? I've already got COPD.
Yeah.
Like, what would you say to someone like that?
Oh, gosh. Okay. So, yeah, thanks. It's never too late. And it is related to the fact that, we know with COPD, it's a chronic condition that people live with. And we know that over time it will progress. And so by stopping smoking, sort of taking that next step, that's one way to ensure that you're reducing how fast your COPD may progress over time. It reduces your risk of having flares and exacerbations of your COPD. It's never too late. And as I said, it reduces your risk of other conditions that can also crop up, and you can be diagnosed while you're living with your COPD. So
right.
It is never, ever too late to quit, even though you have, a diagnosis that you've been told, is chronic and not going to go away.
Right. Okay. Thank you for that. Because, I do feel like sometimes people maybe get that diagnosis and sometimes it, inspires them to quit, but sometimes it just frustrates them and like, why would I? So I feel like that's so encouraging.
For sure. Yeah. It's a potential moment in your life where, you can make that change. And the other thing I might put in as a plug that, exercise. I always, when I'm talking with my patients, sort of speak around quitting smoking as, if you could see me, I'm raising my hand and sort of putting it at the top of a mountain, as sort of that's, really one of the most important things we can do. And then exercise, right? Exercise is right there with quitting smoking and ensuring our good health. And so my patients are much more likely to tell me that they find exercise easier, right?
Yeah.
When they've quit smoking, and they feel like mentally, right? Their mental health is also so much better, both when they quit smoking and also when they do that physical exercise. So there's some other co-benefits that happen.
Yes, absolutely. And that's a great transition to my next question, because you're talking about, talking with your patients about what works and what can help. And so as a respirologist and a researcher who works in COPD and lung disease, can you share a few strategies that folks can use to quit smoking in tandem with managing their lung disease? So for example, when you have patients come to see you and they're looking to quit smoking or you're advising them to quit smoking, what are some resources and supports that you share with them?
Okay, so there's a lot to sort of, I think, say and unpack here, and I think there's many layers you can kind of think of it as. So maybe I'll start with sort of what is in my toolbox as a physician, because I prescribe medication too. So let's talk about the medication that people can use when they're trying to quit. So if you were to just sort of take everybody who might be smoking cigarettes and say, what's your chance of quitting just randomly cold turkey on your own? I'd say it's about 5 out of 100 people. Okay, so which is that's a it's a small percentage, but it's still some percentage of people who will do it on their own without anything. But when you add things like pharmacotherapy, so that would be nicotine replacement therapy. That would be, one particular method. There's other methods like, as I mentioned, bupropion, which kind of is a medication that's used for both mood disorders, but it was also found to be very effective in helping people quit smoking. So the other trade name for that would be Zyban. And then varenicline or Champix, people might know that medicine. So these medications are all, when you add them, okay, on top of sort of somebody's options, they increase that person's likelihood of quitting. So from going from 5% to, say, with varenicline, for example, it's in some studies it's up to about 25%.
Wow.
Yeah, so you can really increase your chance of quitting and then remaining quit, and they measure usually in these studies like at around a year, is someone still not smoking? So it's about a 25% chance. So that's actually quite significant. And what we've learned now there's been many studies and reviews of the evidence that say, so when you combine, right, these medications, and in some cases, varenicline with nicotine replacement therapy, or Zyban with that, or, or for example, using a combination of nicotine replacement therapies like the patch, so a more longer acting kind of sustained nicotine replacement tool with short acting things like gum or your inhaler or something like that. They also increase your chance of successfully quitting and remaining quit. So layering on these pharmacotherapy options really can boost someone's chance. So it's important to have that discussion with your, provider about what might be most suitable for you, because they all potentially have side effects, right? So you want to have a good conversation about that and whether or not that would be something that would be suitable for you. Then I have to say, I jumped into medicine, but really we know that a lot of smoking cigarettes or nicotine, right? It's a very significant addiction. And so we have to handle it as such.
Right.
So we have to be able to recognize that, first of all, people have, relapses. And we know that we socially and in our environment, right, we're cued and triggered by many things. So, having a conversation about, well, what are those, triggers for you as that person? What social environments are more likely to have you smoke, right, or want to smoke? Having a conversation about that so that you're prepared and know, okay, well then how can I potentially, mitigate that is really important. And using things like cognitive behavioral therapy and talking with somebody, right? And it could be a counselor, it could be, we've got pharmacists who are trained in our province to assist with smoking cessation. So having them on your side can help. And then there's more and more, studies that show things like mindfulness, right, can be very effective for some people. Acknowledging that craving for a cigarette and not saying I need it, right, but in fact saying, oh, isn't that interesting? I'm feeling the urge to smoke. Why is that, right? And then kind of using that, sort of being in that moment and acknowledging it. And it's so interesting, even this whole concept of acknowledging some of the things that happen when you stop smoking, like your cravings. It's just like, for me personally, like when I have sometimes tried intermittent fasting, and I feel hungry.
Right.
And so, and for so long, like my response has been to just, when I feel hungry, to, eat something. So I take away that feeling.
Right. Yeah.
But actually, it's okay, right? I can acknowledge it, and I can live through it, and it goes away. So I think a similar kind of thinking could be applied even in this case. So that's around mindfulness. But some people find, like, everybody's different. And so some people find exercise, right? So like that in and of itself, because it creates exercise, right? When you can raise your heart rate, it releases dopamine, which is one of the same hormones that are released when we smoke a cigarette. And so if you can get your dopamine from something else, like exercise in that case, or there might be other things, right, that bring pleasure for you, then you could use those activities as a substitute when you do notice that. So those are kind of, I think, some, combination tools that you could think about. And then, of course, there's lots of organizations, just like Lung Saskatchewan, for example, or Talk Tobacco, or CAMH, which is the Canadian Addictions and Mental Health Organization, that they've got websites and they've got a lot of resources that are available. And so I think those are super helpful. And for example, like I know with Lung Sask, because I've been part of this for many years, has been, the quit campaigns, the Sask Quits campaign that you run every year, and that Facebook challenge. And I've said to my patients, okay, it's running from the end of November, for example, like, I always have to clarify the dates, but, that time frame, go online.
Yeah.
Because there's other people that are going through the same experience as you or that are prepared to share, and you could learn from them. So I think that having a peer network also can be super helpful.
Yeah, absolutely. Thank you for mentioning that. Like we do hear a lot from people who say like the big motivation for me was being able to do those weekly challenges and talk to other people who are going through the same thing. And yeah, we are definitely more active during those challenges, but people can join our Facebook group all year long, and that can be really supportive for people. Yeah. In addition to all those wonderful other pieces to the toolkit that you mentioned. Thank you.
Yeah, you're welcome.
Thinking about quitting or cutting back smoking? Join the Saskatchewan Quits Facebook support group. Or for more quit smoking resources, visit saskquits.ca.
Switching gears a little bit, a conversation that's really gained traction over the last, decade or two is vaping as a quit smoking method. So we know that there needs to be more research on this, but what can you tell us about what we know or maybe what we don't know about using e-cigarettes to quit smoking?
You bet. Okay. So yeah, this has evolved over time, and with this particular question around the effectiveness of a vape device or e-cigarettes to help someone to quit smoking. So someone who's already has an established smoking history.
Yes.
Thankfully, there have now been, a number of many studies actually that have now tried to address this, and with some rigor and some good quality design.
Okay.
So I'll speak to that in a second, and I just want to be very explicit because there's kind of, the issue around vaping is, there's still a lot that we don't know. I think I would be remiss if I didn't mention what we've seen with the uptake in youth.
Absolutely.
Right. And so, and that's a whole, like I'm just going to park it as a separate topic.
Yeah,
but
that's a whole other podcast.
Correct.
Episode.
Yes, exactly. So I'm not referring to, people who are initiating using vaping. We're not going to talk about that. But I will talk. Yes. Okay. And I have had my patients in my clinic ask me about vaping, and my response has changed actually over the last 5 years. So what do we know now? Well, actually last year, so 2025, there was a really big review of the evidence. So it's a Cochrane review. So
yes.
A nice review of the quality of the clinical studies that have been looking at this question. And really what we've seen now is probably with this review, we found out that in total, there's been almost like 30,000 people that have been studied in the multiple studies. There's been almost 50 randomized trials now that have tried to address in one way or another, does using an e-cigarette with nicotine in it, compared to, say, using standard nicotine replacement therapy. Or sometimes studies will look at using an e-cigarette without nicotine. So the studies are all designed a bit differently. Mm-hmm. But at the end of the day, what we found is that when you have a e-cigarette that contains nicotine, compared with standard nicotine replacement therapy, that your chance of helping someone to quit and remain abstinent improves by about 60%.
Wow.
Yeah. And when you look at, say, an e-cigarette that contains nicotine compared to an e-cigarette that doesn't contain nicotine, that also, it's almost fit. So it's, a hazard ratio or relative risk of 1.46. That means you've got a 46% higher chance of quitting and remaining quit with an e-cigarette that contains nicotine in it compared to ones that doesn't. I think what's becoming clear is that, yes, using them can be helpful for individuals in that quit journey pathway. What we don't know is, what dose of, what specific dose to use, like how to kind of titrate the e-cigarette. Is it as effective with flavors versus no flavors, that we don't really have those kind of good quality studies to tell us what to do. But I think, it's now much more, I think, reassuring for me as a clinician to say, okay, I still will use and sort of steer my patients to kind of the established first-line pharmacotherapy options that people, like we've talked about, like varenicline and Zyban and nicotine replacement therapy. However, I have some of my patients who they really struggle. They've tried quitting 10, 15 times in their life, and they have health conditions, above and beyond, say, their COPD that are really, impacted by them continuing to smoke. And transitioning to something like an e-cigarette is, I think, a healthier alternative. We know that the amount of toxins that are released, from burning, compared with a cigarette, right, where we're burning those chemicals. And one way we measure them, we call them tobacco-specific nitrosamines, so TSNAs. Those are very high when we smoke a cigarette. They're, decreased by, an exponential amount in using something like an e-cigarette. So, that exposure is reduced significantly when you're using an e-cigarette. So I think that, that makes good sense for some people. Particularly, people are really struggling with a very strong dependence on it.
Okay. Well, it's interesting how it's evolved over time, hey? Do you have anything to add or maybe can speak to around like dual use?
Yeah. Okay. Yeah. So good question, because there were, when the first trials were being done in e-cigarettes, there was a couple really good quality, one in, I think it was Australia, and I think one in the US that, followed individuals using nicotine-containing e-cigarettes compared with sort of standard nicotine replacement medication. And they had, positive results in those trials in terms of the e-cigarette being helpful. But what they noticed at the end of, 1-year trial was that the people who had been randomized to the e-cigarette with nicotine, yes, they were smoking, or they had quit smoking, but in fact, they were still continuing to use their e-cigarette. And I think that ultimately, even when we transition to e-cigarettes, okay, we also want to have another end game down the road, which is, okay, eventually we'd like to have people off completely, right?
Nicotine-free.
Nicotine-free. Because nicotine, we're learning more and more, actually isn't a benign thing either. So I think there's potential benefits of doing that. So I just wanted to make sure that's that one plug that when people use it. The other issue is that people often, they may start vaping at the time of smoking and it may not be successful, and they may continue with sort of that dual use, as you've said. So that's what that's referring to, and that can be actually, a significant problem, right? Because you're still having the initial, the ongoing risks of smoking cigarettes, but then you have that added additional nicotine, and then the unknown potential. I'm going to call them safety concerns or even harms that can that we do know that have that are related to flavors. They're flavors are not regulated in vape devices, and every flavor, right? We have thousands of them now on the market. They're created by chemicals.
Right. Flavoring is not an ingredient.
That's right. Flavoring are chemicals. Yeah. That when you heat the chemicals, they can actually transform and change, right? Their molecular structure. And in some chemicals, that can actually cause direct harm and toxicity to your lungs and beyond. We're actually understanding now it's not just the lungs, your cardiovascular system, your blood vessels. So again, yes, dual use is an important thing. So if you're going to start that as your tool, there has to be a stop date in mind for either one of them, and ideally, long term, both.
Yeah. Okay. It's also nuanced. Hey, like there's so many tools that you can add to your toolkit, and everybody is unique on their quit journey, right?
Yeah. Yes, that's exactly it.
Yeah, absolutely. Well, one last question, and this is one that I often ask. You've been on my panel discussions about quitting smoking, and it's like how I like to close the conversation is what's one last thing or one tip that you want people to know who maybe are starting their quit smoking journey?
Now that I am, how many, maybe 13 going on 15 years of practice, and in this space of helping people to quit, what's really important is, I think we need to be kind to ourselves, right? So be gentle.
Yeah.
Be ambitious for sure, right? Don't you can do it.
Yes.
Right? There's so much supports now that this is not an impossible thing to tackle. But it is hard.
Yeah.
Yeah. And so, and hard things require us to be sometimes gentle and also know that when we have, a relapse, right, where we may start smoking again, after whatever amount of time, whether it's 3 days of not smoking or maybe 3 months, or sometimes it's 18 months later, that's actually, it's not a failure. It's a bump in the road, or in Saskatchewan, it's a pothole.
Yeah,
right?
Absolutely.
Yeah. And so, and those can be overcome. And you get back up on your bike and you kind of brush yourself off, and then you continue, and you might try something different, right? Or you reflect back on what happened. And sometimes there's very good reasons, life events, we're all human beings and trying to live a life here, and sometimes bad things happen, and so I guess it's mostly that, to have some grace with yourself, and to tell other people what you're doing, right? Because it's really important to let people know that you're going to try this, because they can be supportive. Your own environment, right? Your friends, your family may also change their behaviors at the time that, right? If you give them a chance to know what you're planning for your health, they might also do the same. And then you've got, I think, strength in numbers.
Yeah, absolutely. Beautifully said. Thank you so much, Dr. Penz, for joining me today and sharing your knowledge and expertise with us. If listeners take anything away from our conversation, I hope that they know that quitting really is a journey. The best thing that you can do for your health is to start quitting, and it's never too late. To our listeners, no matter where you're at on your quit journey, please consider joining us in the Saskatchewan Quits Facebook support group, and visit saskquits.ca for even more resources. Thanks again to Nicorette for supporting today's episode of Let's Talk Lungs. Thank you, Dr. Penz, and thanks to our listeners for joining us.
Thanks for listening. If you enjoyed this episode and you'd like to help support Lung Sask's Let's Talk Lungs podcast, please share it with others. Post about it on social media. Like, subscribe, hit that notification bell for new episodes, and leave us a review. Follow Lung Sask on Instagram @LungSask and on X @LungSask. That's all for this episode. See you next time.
Produced at
Sound Lounge by T-Bone.